Hi, my name is Reeve Conover, and this is a primer on level-funded health plans for small groups. Self-insurance has existed as long as I've been in the business. 30 plus years ago, we were using Chubb split-funded plans and self-insuring large groups. With the advent of community-rated health plans in '93 and then Obamacare in 2012, level-funded plans became, well, the old way. But the Affordable Care Act isn't so affordable, as everybody knows. And so what's old is new again. Let's take a look at level funding and why it works. So let's take a look. Level funded plans save clients 15 to 30% on premiums on average. I've seen as high as 50%, but not everybody's going to qualify. Your employees get a national provider network, a national pharmacy carrier. We are able to customize the benefits better because it is level funded. There's a lot more flexibility. Because we're unbundling, meaning we're separating all the parts of the plan, there's sometimes a little more paperwork for you and I, but for your employees, it's a simple computerized enrollment process. And so that makes it a lot easier. Do understand that your group can be declined for coverage. Because you see, here's the difference. In a traditional funded plan, United Healthcare, the Blues, some of the larger typical carriers, there are no medical questions. That's the rule under Obamacare. You typically get an age-weighted price, so older people pay a lot more, younger people pay a lot less. And because we're pooling all of our rates, meaning we've got both the sick people in the pool and the healthy people in the pool, your rates are going to generally be higher. Everything with traditional funding is bundled. So if you contract with a traditional carrier, that carrier is providing the doctor's network, the pharmacy network, the claims processing, the website, the phone system. They're selecting employee assistance programs, etc. On the other side, with level funded plans, the first thing is we're going to go level funded because you're willing to prove that your group is healthier than the average group. In essence, we're going to pull those sick people out of the pool and leave only the healthy people. That leaves us lower rates. Typically, we get a composite rate. We get one rate for everybody in the company. They're not pooled. So again, we're going to have lower numbers and we're unbundling things. So you're going to see that we get a lot more flexibility by selecting providers for different pieces. So when we talk about unbundling, what does that really mean? Well, it means that we're going to choose a provider network. In a lot of cases, these are some of the large rental networks like Cigna and Aetna. They're going to choose a pharmacy benefit manager. Could be Optum, could be Caremark, could be Express Scripts, but we're going to choose one of those based on pricing. They're going to go out and purchase reinsurance. Reinsurance protects the employer from having a massive claim. And all regular insurance companies do pre-insurance. It's just that you're not aware of it because it's all bundled together. And they're going to process the claims. Well, we're going to hire a third-party administrator to pay our claims for us and to handle the phones and to generate all of the paperwork and things like that. Now, what you'll notice here in the middle is that in a traditionally fully insured program, if you only use 60 cents on the dollar for your claims, where does that money go? The insurance company keeps it. Whereas with level funding, not only are we typically getting lower rates up front, but there's a potential savings at the end of the contract. If there's still a bunch of money in your claims pool that hasn't been spent, you share in that. Another option that we have with level funded is to go reference-based pricing. Now, this is a completely different approach. In a traditional world, the insurance company negotiates a fee with the providers and the hospitals, and reference-based pricing does not do that. They simply pay 130% typically of the Medicare rate to the doctor and 150 to the hospital. Now, that may sound low to you, but the insurance companies have negotiated so hard that in many cases, this is actually higher pay than the provider is getting that's in a network. Reference-based pricing, because it just uses Medicare rates, doesn't have a network. Your doctors can go anywhere. This eliminates the issue of, oh, well, then my doctor's not in that network. It allows us to reduce a number of fees, and it's been in use in this country for more than 10, 12 years, and in large states where their whole state plan runs on reference-based pricing. It's a great way to reduce expenses. Okay, Reeve, so how does all this work? Well, here's what will happen. You're going to provide us with an Excel spreadsheet with your employees' information. We are going to load that into a secure website. The employees will then log in, answer medical questions, indicate who's going to be covered or if they're waiving coverage. When all your employees have done so, we then push a button and the information goes out securely to the underwriters of between 10 and 15 companies typically. We'll then get back final rates based on the actual medical conditions in your group. We select, you and I, which plan makes the most sense for you, and then we push a button and those employees get enrolled into that program. They don't have to fill out any other additional forms. There's no extra paperwork on their part. Okay, so a common question I get here is, who's going to see all this private information from my employees? Well, the underwriters get it securely through the website. I get a copy in PDF form that is password protected and stored in my system so that I can review the information, understand what we're dealing with, and very often negotiate with the insurance companies on your behalf. You, however, Mr. Employer, don't get any of that information because that would be a HIPAA violation. You'll know down the line what your claims are, but you will never know what the claims are for. Your employee privacy is protected. Okay, so now we go in, we look at the rates, we make a plan selection. What happens next on your end? Well, you're going to sign the master contracts by DocuSign. We'll go through those. We'll make sure that we get all the details. The employee data goes directly in, as I said before, into the plan, and we don't have to have the employees fill anything further out. Within about 2 weeks, they'll get their employee cards. It's important to note here that census is very important because of the way level funding works. If there are census changes after we put the information into FormFire, that can change your rates. So it's important that we capture the correct information early. So in summary, your employees get coverage similar to what they have now, with plan designs that may be more customizable and more appropriate for your employee group. Assuming that your group is healthier than the average group, this is going to save you premiums. If your group is not healthier than the average group, you may not go level funded. And if you stay a healthy group, something you don't have any control over during the year, in the end, it may save you more and you may get another check back. For more information, give me a call. Reeve Conover at Conover Consulting. My information's there on the screen. Happy to help you and have a conversation with you at any time.